Greetings, my name is Dr. Ashish Karthak, and the topic for my presentation today will be on tocilizumab. Tocilizumab, trials and tribulations. Tocilizumab is also known as Actemra and atezolizumab. It is a immunosuppressive humanized monoclonal antibody drug. It selectively and competitively binds to soluble expressing the IL-6 receptor and then blocking the signaling caused by IL-6. Tocilizumab has been mainly used for moderate to severe active arthritis in adults, giant cell arteritis, polyarticular juvenile idiopathic arthritis, cytokine release syndrome in patients 2 years of age older with active disease, and the recommended dose is 4 to 8 mg per kg. An ongoing active infection is a contraindication for the use of tocilizumab. Tocilizumab has been known to cause side effects like headache, hypotension, elevation in liver tests, respiratory tract infections. It might also cause reaction at the local injection site, and before starting tocilizumab, associated serious infection like tuberculosis, sepsis, and fungal infection has to be ruled out. Tocilizumab inhibits IL-6 receptor, which is a key cytokine leading to an inflammatory storm, which may result in increased alveolar capillary blood gas exchange dysfunction, especially impaired oxygen diffusion, and eventually lead to pulmonary fibrosis and organ failure. So is tocilizumab the answer for COVID-19 treatment? We shall look into different trials and journals to answer our question and find a better solution for the treatment. Covacta, a global randomized double-blind placebo-controlled phase 3 study, evaluated the safety and efficacy of intravenous tocilizumab added to standard of care in adult patients with severe COVID pneumonia compared to placebo plus standard of care. However, the study did not meet the primary endpoint. There was no difference between tocilizumab and placebo in the percentage of patients that died by week 4. Time to hospital discharge was shorter in patients treated with tocilizumab. The difference in ventilator-free days between tocilizumab and placebo was not statistically significant. Impacta, evaluating minority patients with Actemra, is a randomized double-blind placebo-controlled phase 3 trial to evaluate the safety and efficacy of tocilizumab in hospitalized patients with COVID-19 pneumonia who were not receiving mechanical ventilation. The enrollment of patients from high-risk and racial and ethnic minority population was emphasized. The trial showed that the likelihood of progression to mechanical ventilation or death by day 28 was significantly lower among patients who received tocilizumab plus standard care than among those who received placebo plus standard care. REMAP-CAP is an international adaptive platform trial designed to determine effective treatment strategies for patients with severe pneumonia in both pandemic and non-pandemic settings. The trial evaluated tocilizumab and sarilumab in an ongoing international multifactorial adaptive platform trial. Adult patients with COVID-19 within 24 hours after starting organ support in the intensive care unit were randomly assigned to receive tocilizumab, sarilumab, or standard care. The trial showed that in critically ill patients with COVID-19, the IL-6 receptor antagonists tocilizumab and sarilumab are both effective compared with current standard of care. Benefit was consistent across primary and secondary outcomes and across subgroups and secondary analysis. The randomized evaluation of COVID-19 therapy trial is an investigator-initiated, individually randomized, controlled, open-label platform trial to evaluate the effects of potential treatments in patients hospitalized with COVID-19. The results of this large randomized trial indicate that tocilizumab is an effective treatment for hospitalized COVID-19 patients who have hypoxia and evidence of inflammation. Treatment with tocilizumab improves survival and the chances of discharge from hospital alive by 28 days, and reduce the chances of progressing to require invasive mechanical ventilation. CORIMUNO-TOCI-1 is a cohort-embedded, investigator-initiated, multicenter, open-label randomized clinical trial investigating patients with COVID-19 with moderate or severe pneumonia requiring at least 3 liters of oxygen but without ventilation or admission to the intensive care unit. In this clinical trial, tocilizumab did not reduce WHO CPS scores lower than 5 at day 4, but might have reduced the risk of non-invasive ventilation, mechanical ventilation, or death by day 14. There was no difference on the mortality at day 28. Gupta et al. In their study used data from the Stop COVID, a multi-center cohort study, and emulated a hypothetical target trial in which critically ill adults with COVID-19 received or did not receive tocilizumab in the first 2 days of intensive care unit admission. The study found that among critically ill patients with COVID-19, the risk of in-hospital mortality was lower in patients treated with tocilizumab in the first 2 days of ICU admission compared with patients whose treatment did not include early use of tocilizumab. Emily C. Somers et al. Assessed the effectiveness and safety of IL-6 blockade with tocilizumab in a single-center cohort of patients with COVID-19 requiring mechanical ventilation. In this cohort of mechanically ventilated COVID-19 patients, tocilizumab was associated with lower mortality despite higher superinfection occurrence, but there was no difference in 28-day case fatality rate among tocilizumab-treated patients with versus without superinfection. Giovanni et al. Did a retrospective observational cohort study aimed to assess the role of tocilizumab in reducing the risk of invasive mechanical ventilation and death in patients with severe COVID-19 pneumonia who received standard of care treatment. The study showed that treatment with tocilizumab, whether administered intravenously or subcutaneously, might reduce the risk of invasive mechanical ventilation or death in patients with severe COVID-19 pneumonia. Carlos Salama et al. Conducted a randomized, double-blind, placebo-controlled phase 3 trial to evaluate the safety and efficacy of tocilizumab in hospitalized patients with COVID-19 pneumonia who were not receiving mechanical ventilation. The study emphasized the enrollment of patients from high-risk and racial and ethnic minority groups. The trial showed that the likelihood of progression to mechanical ventilation or death by day 28 was significantly lower among patients who received tocilizumab plus standard care than among those who received placebo plus standard care. It also suggests that patients who are most likely to benefit from tocilizumab have moderate or severe disease, and that tocilizumab may add to the potential benefit of antiviral treatment and glucocorticoids. COVINTOC is an open-label, multi-center, randomized controlled phase 3 trial done at 12 public and private hospitals in India to investigate the clinical outcomes and safety of tocilizumab plus local standard care versus local standard care alone in patients with moderate to severe COVID-19. The primary and secondary endpoints of the trial were not significantly different between tocilizumab plus standard care and standard care alone. Thus, the study did not support the routine use of tocilizumab in adults with COVID-19. However, the post-hoc analysis suggested that patients with severe disease at baseline, most of whom were not on mechanical ventilation, might have a reduced risk for progression to death if treated with tocilizumab in addition to standard care. Ivan O. Rosas et al. In their phase 3 trial randomly assigned and observed patients who were hospitalized with severe COVID-19. The trial was conducted at 62 hospitals in 9 countries in Europe and North America. The trial found that the use of tocilizumab did not result in significantly better clinical status or lower mortality than placebo at 28 days. However, the data suggested a possible benefit for tocilizumab in the time until hospital discharge or readiness for discharge and in the duration of ICU stay. Salvarani et al. In their prospective open-label randomized clinical trial randomized patients hospitalized with COVID-19 pneumonia and evaluated the effect of early tocilizumab administration versus standard therapy in 24 hospitals in Italy in preventing clinical worsening in patients. Unfortunately, in this randomized clinical trial, no benefit on disease progression was observed compared with standard care. And lastly, J. H. Stone et al. Performed a randomized double-blind placebo-controlled trial involving patients with confirmed severe acute respiratory syndrome. Findings from this trial indicated that tocilizumab was not effective for preventing intubation or death in moderately ill hospitalized patients with COVID-19, but the investigators noted that because of the width of the confidence intervals for the efficacy comparisons, they cannot exclude the possibility that tocilizumab treatment is associated with either some benefit or harm in some patients. So, based on our review of several study trials and journals, tocilizumab should still be considered for the treatment of COVID-19 as it has known to show following benefits: less likely to progression to mechanical ventilation or death, less median organ support-free days, reduction of progression of severity of disease at day 14, and greater possibility of discharge from hospital at 20 days. Thank you.